Hello guys, today we are going to discuss about diuretics. These are the drugs which are used in nephrological cases or urological cases. So these diuretics are the drugs which increase the rate of urine formation with natriuresis. So basically this is the definition of diuretics. So these are the drugs which are used for the patients who are suffering with kidney diseases, and most of the time we hear that the person who is having edema is suspected to have some kidney disease. So in this edema we find the sodium and water retention in a person's body. So when these diuretics are given, the rate of urine formation and the rate of urination increases in the person, and thus the person's water which is present in the form of edema over his body will be removed. So coming to the definition of natriuresis, it's a very simple term. So it is the excess loss of sodium in the urine. So usually it's a easy term to remember. We have Na in the spelling, so usually we write sodium as Na. So remember it like that. So it is loss of sodium in the urine. So coming to the diuretics, we have a classification. So that classification includes weak diuretics, moderately efficient diuretics, high efficient diuretics, and potassium sparing diuretics. So let's remember this in the form of strength. So when the person is weak, we call weak, right? So let's increase the strength. So that's the way you can remember this. It is weak, moderate, and high. And the last one is potassium sparing. So when we come to weak diuretics, we have sub classification. So that mnemonic to remember this weak diuretics is COX. COX. So here we have osmotic diuretics, xanthan derivatives, and carbonic anhydrase inhibitors. So C stands for carbonic anhydrase inhibitors, and O stands for osmotic diuretics, and X stands for xanthan derivatives. So in this osmotic diuretics, sodium and potassium salts. Okay, next coming to xanthan derivatives, the examples are aminophylline, theophylline. So xanthine and aminophylline and theophylline. So these are the examples. Carbonic anhydrase inhibitors. So the example is acetazolamide. Coming to moderately efficient diuretics. So in this also we have subtypes. So the earlier subtypes were COX, COX. C stands for carbonic anhydrase inhibitors. O stands for osmotic diuretics. Z stands for xanthine derivatives. So in that same case we have two subtypes here. Like two subdivisions. One is osmotic derivatives and benzothiazides. So these are simply called as thiazides. Okay. So for this the mnemonic is OB. Okay, OB. It's very simple to remember. So earlier we have seen osmotic diuretics. So here those examples are mannitol, sucrose, glycerol, isosorbide. Repeat it with me: mannitol, isosorbide, sucrose, glycerol. The mnemonic for this is Miss G. MIS Miss and G. M stands for mannitol, I stands for isosorbide, S stands for sucrose. There ends Miss, and coming to G, it is glycerol. Okay, I hope it is clear. Coming to thiazides, indapamide, chlorothiazides, benzothiazide. So for this thiazide we have the suffix as IDE. So whenever you find something ending with IDE, you have to immediately recall that that belongs to thiazide. So in this moderately efficient diuretics, these inhibit the import of sodium and chlorine, that means NaCl. Next, it is moderate in action. So it causes excretion of 5 to 10% of filtrate NaCl. So when all that excretion process, in all that excretion process, only it causes 5 to 10% of filtered NaCl to be lost in the urine, and it is wide spectrum. Its duration of action is 8 to 72 hours. So it is ineffective with glomerular filtration rate 30 ml per minute. Okay, so in this we had osmotic and B for benzothiazides. Okay, coming to the third type, it is highly efficacious diuretics. So instead of telling highly and all that, we can say high ceiling loop diuretics. So the common drug which we find in the wards is furosemide. Okay, we find it very common in all kinds of wards, especially in the Euro ward. So that furosemide is a loop diuretics, and other examples are mefruside, butinatide, ethacramic acid, ethacranic acid. Sorry. So let's repeat it once again: furosemide, mefruside, butynatinide, ethacranic acid. Okay, so earlier we have seen in moderate efficient diuretics. So uh, in that they inhibit the import of NaCl. Here sodium, potassium and chloride import is inhibited, and its duration is very short. So let's learn it as comparison. So coming to high efficacy, if its efficacy is high but its duration is short. Moderate diuretics, its efficacy is a bit less than high diuretics, but its action is more, duration of action is more. Okay, here 15 to 20% of filtered NaCl is released, and here 5 to 10%. So it is effective even in mildly decreased GFR rate. So here in moderately it is ineffective if GFR rate is 30 ml per minute. Okay, coming to the fourth one is potassium sparing diuretics. So in this potassium sparing diuretics we have aldosterone antagonistics, renal epithelial sodium channel inhibitors. So this aldosterone antagonistics, so these are something like they work against the action of aldosterone. Okay, so in that we have examples as spironolactone, potassium canreonate and eplerenone. Okay, renal epithelium sodium channel inhibitors. In that we have trimetrin and amiloride. Okay, so let's conclude this. So in these diuretics, these are the drugs which increase the formation of the urine, or this increase the urination. So we have classification. In classification we have weak, moderate, high and potassium sparing. So under weak we have COX as mnemonic. C stands for carbonic anhydrase, O stands for osmotic diuretics, and X stands for xanthine derivatives. So xanthine, okay, thine, remember thine, and you have to recall aminophylline and theophylline. Coming to carbonic anhydrase, acetazolamide. Okay, in moderately we have the mnemonic OB. O stands for osmotic diuretics and B stands for benzothiazides. So in osmotics, the examples we have a mnemonic MIS G. M stands for mannitol, G stands for glycerol, I stands for isosorbide and S stands for sucrose. Okay, thiazides. So anything which ends with ITE is a thiazide. So indapamide, chlorothiazide, benzthiazide. Okay, coming to high efficacy diuretics, we have furosemide, ethacranic acid. So comparing both of these functions, it's like high it is short duration, low it is long duration. This high inhibits Na, K, and Cl symport, and this inhibits NaCl symport. Excretion is 15 to 20% and 5 to 10%. So effective in lower GFR, ineffective in GFR 30 ml per minute. So coming to the potassium pairing, we have aldosterone antagonistics and renal epithelial sodium channel inhibitors. So I hope the classification of diuretics is clear to you, and if you want me to do video on any other topic, please comment it down. In the next video we'll be discussing the classification of diuretics according to the site of action. So stay tuned for the next video, and I hope this video is clear. Thank you for watching. Please share and subscribe to this YouTube channel. Thank you.